parents with young children need daycare centers to open as well. Tom Wyatt is the CEO of Kindercare Education, one of the largest early education and child care companies in the country. Mr. Wyatt, it's good to have you on the program tonight. Thank you for being here.
My pleasure.
What is the status of your facilities right now?
Well, today we have we have 1,500 facilities around the country in total. Right now, around 600 of them are open. We had 450 open during the first 7 weeks, really serving the essential workers, which we were very proud to do. But as states have opened last week and then again this week, we have opened in about 10 states, and next week we'll open in an additional 15 states. So we're starting to expand out.
Many parents are obviously going to need your services. How are you thinking about this issue of businesses reopening and getting back to work, and whether you can be ready to serve them?
Well, because of the 450 that we had open during the height of the pandemic, if you will, we learned a lot. We worked closely with CDC. We built in, obviously, new safety protocols, health protocols. We've been doing those consistently in those 450 centers since the week of the 23rd of March. And as we begin to bring on the new centers and new states as we go forward, we will use the, if you will, lessons learned, social distancing, frequent hand washing, asking parents to drop their child off at the front of the center and not go back to the classroom. We'll take the child back. So we're trying to do our best to get as few people going through the center other than, quite frankly, the teacher and the child.
Yeah. How are you dealing with the issue of masks, liability if children do get sick at your facilities? How are you thinking about all of that?
Well, start with the mask. All of our staff in a center is required to wear a mask. We also have PPE, and we wear gloves, especially the cook and the others that are involved with the food. So all that's done in that way. For anyone that were to contract the virus, or we learn that they've contracted it either before or after they've been in the schoolroom or in the classroom or through the center, we shut down that center for at least 72 hours. And we obviously sanitize the center. And then at that point in time, we decide if it's safe to bring everyone else back. And of course, any teachers that come in contact with that child, should it be a child or could be a teacher, they are obviously quarantined as well.
Sounds like a funny question to ask, but do children have to wear masks?
That's not a funny question to ask. There are some states that started out saying they wanted children even 3 years old wearing a mask, and it's simply impossible. They take them off. They're quite frankly a bit of a choking hazard. So no, the children do not wear masks.